All right, if you're a student, especially one following FZ-LabTech, you already know that the biopsy is pretty much the cornerstone of histopathology. But let's be real, with so many different types, from needles to scalpels to scopes, it can get confusing fast. So in this explainer, we're going to break it all down for you and make it crystal clear. First, we'll cover the basics. What even is a biopsy? Then we'll jump into the different ways we get a sample. We've kind of grouped them into three main categories to make it easier: the needle approach, biopsies from the skin's surface, and then the more invasive methods using scopes and surgery. And we'll wrap up by looking at something really cool on the horizon: the liquid biopsy. So, what is a biopsy, really? At its core, it's a pretty straightforward but incredibly powerful idea. A doctor takes a small piece of tissue, or sometimes just a few cells, from the body. That sample gets sent to the lab, where it's put under a microscope. That one step gives the definitive answer for so many diseases, from cancer to skin rashes. It's literally the bridge between just suspecting something is wrong and getting a certain diagnosis. First up, let's talk about the needle approach. These techniques are all about getting tissue samples from deep under the skin, like from an organ or suspicious lump, with the least amount of fuss. Think of it like medical reconnaissance. You're getting that critical intel without having to go in for a full-blown operation. So this table lays out the big three needle techniques. Now, a core biopsy is super important because its wide needle pulls out a solid cylinder of tissue. This preserves the tissue architecture, how the cells are arranged, which is everything to a pathologist. A fine needle aspiration, or FNA, uses a much thinner needle to just get a smear of cells. It's less invasive for sure, but also gives you less information. And then you've got the high-tech version, image-guided, where a doctor uses an ultrasound or a CT scan to literally watch the needle in real time and guide it to the perfect spot. Let's zero in on that image-guided biopsy for a second. This is a perfect example of a classic trade-off you see all the time in medicine. On the one hand, the benefits are incredible. You get this pinpoint accuracy, even for tiny lesions deep inside the body, so there's way less chance of missing your target. But of course, that kind of precision doesn't come for free. It requires expensive specialized equipment, and if it's guided by CT scan, well, that involves a dose of radiation for the patient. Okay, let's switch gears. We're moving from those deep tissues right up to the surface. We're talking skin. These biopsies are all about figuring out what's going on with rashes, moles, and other things you can actually see and touch. A really common one here is the punch biopsy. It uses this neat little tool that honestly looks like a tiny cookie cutter. After numbing the skin, the doctor just twists it, and it removes a perfect little core of skin. The key takeaway here is that it gives a full thickness sample, getting everything from the top layer, the epidermis, all the way down into the dermis. And getting that full depth is absolutely critical for diagnosing a ton of skin conditions. You see the pattern here, right? It's all about the depth. A shave biopsy just kind of skims the very top layer. It's great for something superficial like a wart, but it's a terrible idea if you suspect something like melanoma, where you have to know how deep it goes. The punch gets you that full thickness we just talked about. And then there's the excisional biopsy. That's where the doctor cuts out the entire lesion. It's not just for diagnosis. It's often the first step of treatment, especially for melanoma. Okay, so now we're diving even deeper. What happens when a needle isn't quite right and the problem isn't on the skin? Well, then doctors need to actually go inside the body. This is where the scopes and scalpels come out, giving them a direct look and the chance to get much bigger, better samples. What you're seeing here are two totally different approaches. An endoscopic biopsy is pretty clever and minimally invasive. A flexible tube with a camera goes in through a natural opening, like your mouth, to get a stomach biopsy. The only downside is the samples can be kind of small. On the flip side, you have the surgical biopsy, which is what pathologists call the gold standard. Sure, it's a full-on operation, but it gives them a large, complete sample with the most information possible. And we gotta talk about two other big ones: laparoscopic and bone marrow biopsies. Laparoscopic is like keyhole surgery for organs in your abdomen, but the bone marrow biopsy is really unique. A needle goes into the hip bone to get a sample from the body's blood cell factory. For things like leukemias and lymphomas, this is often the only way to get a solid diagnosis and see exactly what's going wrong right at the source. All right, for all you students out there, you're gonna love this. Here's a great mnemonic to help you remember the 10 major types we've just covered. Cool, smart nurses, in surgery, should examine little big lesions. That's for core, skin, needle, image-guided, surgical, endoscopic, laparoscopic, bone marrow, and the last two? Big and lesions are just part of the phrase, but little is for the one we're about to cover: liquid. And that covers the major ways we actually get a tissue sample. But hang on, before we look to the future, we have to talk about what happens right after the sample is taken. Because honestly, getting the sample is only half the battle. A perfect biopsy can be ruined by simple mistakes. First, labeling. The container absolutely must have at least 2 unique patient identifiers. A mix-up is a disaster. Second, fixation. The tissue has to go into a fixative, usually 10% formalin, right away. This stops decay. A dried-out sample is useless. Okay, now with those crucial lab points in mind, let's look at the future. Just imagine that for a second. What if we could get all the information we need to diagnose and monitor a major disease without ever having to cut into the body? Well, that is the incredible promise of the liquid biopsy. Now, don't let the name fool you. A liquid biopsy isn't actually a biopsy of a liquid. It's a test done on a liquid, almost always blood. See, tumors are kind of messy. They shed these tiny fragments of their DNA, and sometimes even whole cells, right into the bloodstream. With a liquid biopsy, we can analyze a simple blood sample, find that material, and effectively perform a biopsy without ever touching the tumor itself. And the potential here is, well, it's a total game changer. It is as minimally invasive as you can possibly get. I mean, think about it. You could track how a patient is responding to cancer treatment every single week, just with a blood test. It has the potential to detect cancer way earlier than any scan could. It can even give you a snapshot of the genetic makeup of the entire tumor, not just the tiny piece one needle might hit. Okay, but let's pump the brakes a little. It's really important to know we are not quite there yet. The tech can still miss tumors that don't shed a lot of DNA into the blood, which means you could get a false negative. It's expensive, complex, and, this is a huge one, it tells you nothing about the tissue architecture. All that crucial info about how the cells are arranged is completely lost. So for now, it's a tool that complements traditional biopsies. It doesn't replace them. So that leaves us with this really big, fascinating question. We've gone from the scalpel to the needle to the endoscope, and now, maybe, to a simple vial of blood. As this liquid biopsy technology gets better, more sensitive and cheaper, could we be looking at a future where the scalpel becomes a museum piece for cancer diagnosis? Definitely something to think about. And that's a wrap. I really hope this helped clear up the world of biopsies for you. For more simplified explainers on lab topics like this one, make sure you subscribe to FZ-LabTech. Thanks for watching.